It's Friday the 13th, August 13th. And, on one hand, I'm happy that we only have 2 deaths, but it's still terrible. And I ask for your prayers like I always do, but our 2,975th death in West Virginia is an 84-year-old female from Raleigh County. Both these folks were from Raleigh County, and our 2,976th death is a 62-year-old female from Raleigh County. I grew up, for all practical purposes, in Raleigh County, and got a lot of great friends and a lot of ties there, and I ask for your prayers again for these great folks that we've lost. We had 243 new positive cases, and our daily positivity rate was 1.44. Our cumulative rate is at 4.95. Here's where it gets tough. We have now active cases of 5,312. That's no good. We've recovered cases of 163,000 and change. We have 312 people that are hospitalized in West Virginia. And we have 109 people in the ICU units. That's all tough stuff, and I hope everybody's hearing me. But we have 3 red counties now, Marshall, Wetzel, and Wayne, and only 13 counties in the green. I remind those, like I've said over and over, if you're 65 and older and you get any kind of symptoms whatsoever, whether you be vaccinated or not, please go get tested. Please just get tested. These antibodies may very well save your life in every way. I got, evidently, because the Charleston Gazette can't seem, to God above to get it right no matter what they try to do. Maybe they purposely are just trying to get it wrong. But in regard to the face coverings, where we are right now is in the state of West Virginia, I see no need to absolutely put out any kind of level of executive order to mandate face coverings at this point in time. We're going to leave that to the local control. We see all this stuff that's going on, and some of it can get right carried away and right silly, but from the standpoint of mandates, we always want to leave everything open and on the table, do we not? We all know there's no playbook, and we all know we've got to be fluid, and we've got to be fast on our feet to move and move to the best of the abilities and knowledges that we have. But if you'll just step back and think just about this, in the state of Florida today, we're fighting local versus the government, the governor. And the governor now is putting out a mandate that the counties can't mandate, and so, or the cities can't mandate. So you basically got a mandate against a mandate, and in the state of Texas, I think today said that they're bringing in 2,500 out-of-state healthcare workers to be able to handle the surge that's going on there. We have situations that we got to deal with, but in West Virginia, whether you're pro-mask, anti-mask, no matter what you are, in West Virginia today, we have a lot of good folks on the local level that absolutely are monitoring what is going on within their counties, within their cities, and those people have got to be extended what we've already done in the past. We have extended local control to our schools, and we've got to give them that priority or flexibility, because this is not a one-size-fits-all deal. Right now, we see no reason for these mandates, and surely mandates against mandates. And so with all that being said, I don't know how to make it any more clear than that, but we have got to always understand very clearly. We learn from others. We continue to take advice from our medical experts. Without any question whatsoever, we have got to be prepared to change and to move. We've done it and done it and done it. And that's what we're going to continue to do. The FDA is, we're still working and working on the booster shots, but last night the Food and Drug Administration authorized COVID-19 vaccine booster shots for people with a weakened immune system. The FDA emphasized that other fully vaccinated people are adequately protected and currently do not need an extra dose. From the standpoint as soon as this approval happens, we will be ready to move forward, as General Hoyer has said over and over. And the CDC's, and this is the ACIP committee, must also recommend the booster shots before we can start giving them out. And so once that approval comes from the CDC and they approve and we move forward, and the ACIP committee approves, we'll start immediately. And from day one, we've been the leader in the vaccinations, and we're ready to go on the booster shots, and we'll get those in the arms of lots and lots and lots of folks as quickly as we possibly can. As soon as the CDC moves, we'll move that next day or that day. Like I said, on the Delta variant, we see all the numbers. We see all the colors of our state. We see it. We don't have to be rocket scientists to know that right now we've got 317 Delta variant cases in West Virginia. Now just think about this. Do you remember when we had, I don't know what the number was, but it was like 12. And we sat around, we had 12, and then we went to 18 or something. And then we jumped from 18 to maybe 25. And on a percentage basis, it was pretty significant. But on a purely number basis, or a singular number, it didn't seem like much, did it? Well, now we're at 317. Just look where we've jumped. We've jumped, from that period of time. And so we really, really got to watch here. I would say, as I've said over and over and over, if there was ever a time in your life to get vaccinated, if there was ever a time for you to get your kids vaccinated, right now's the time. You got to move. You have to move. We had over 3,800 doses given out since Monday. We're at 1,082,044 people in West Virginia who have received at least one dose. We're at 89.9% of the over 65s that have received one dose. We're at 83.2 that are over 50 that have received one dose. And we're at 69.5% of the 12 and older, the people that are eligible for vaccinations in West Virginia. We're right sitting on 70%. We got to get higher than that, but that's a heck of an accomplishment to get to there. Vaccine eligibility, 12 and older, get your second shot. Young people, please listen to me. Please listen to me. You're going back to school. Please, parents and grandparents, listen to me. Listen to me in every way. You're going back to school. You're going to be around a lot of your friends and everything. We want your school year to be fantastic. Especially you think about you're going back, and many of you are going back as athletes. And you're going back and you're in practice, and you're looking for all kinds of fun and greatness in your sporting activities. Think about if you're in the band. Think about how important that is and everything. Absolutely, come on, mom and dad and your grandparents. Encourage those kids in every way that they've got to get vaccinated. There's so many places to do it. It absolutely will ensure all kinds of goodness. It is very, very safe. Please helped me with getting our young people across the finish line. All the COVID information's up on our website. All the free testing's up. I thank Frith and I thank Walgreens all the time, and I really appreciate it. We go back a long ways to that drive-through testing, but all that's up and everything there. We have 18 outbreaks in our long-term care facilities. We have 12 outbreaks in our church community. It's 11 counties now, and those counties I always read: Cabell, Fayette, Jackson, Jefferson, Mason, McDowell, Nicholas, Putnam, Raleigh, Taylor, and Wayne counties. We had 27 inmate cases, 12 staff cases. I always encourage everybody about giving blood. That's really, really important. I want to talk a second about the census data that just came out and everything. West Virginia's population down again, 3.2% over the past decade. It's a big drop. I think there was, we lost another congressional seat. I think the drop was the most of any state in the country. Our population fell by almost 60,000 people. We had a population loss in 47 out of 55 counties. Berkeley was the biggest increase over in the Eastern Panhandle, along with Jefferson. Berkeley County had a 17.2% increase. Jefferson a 7.9% increase. Kanawha County fell 6.4%. Kanawha County is still our biggest county. Mon County saw a nice increase and everything, and they now have overtaken Cabell County as the third biggest county. McDowell County again lost big time population, 13.6%, and now they're down to a population below 20,000, first time since 1990. If I remember correctly, McDowell County at one time had over 100,000 people in McDowell County. Pendleton County, lost the highest percentage of any county, 20.2%. Followed by Ritchie County at 19.2% and Calhoun County at 18.8%. Those losses are astronomical, and those are beautiful counties. Beautiful, beautiful counties. Just think about one thing, though. Think about the fact that we led the nation. We led the nation in getting counted in the census. Now let's just step back from this just a second. And I know I'm going to probably draw some level of criticism for this, but I really believe in my heart that we have got so many accomplishments in West Virginia. We've done so many good things. We have absolutely knocked it out of the park over and over, and West Virginia is doing really good. West Virginia is on its way. West Virginia is that diamond in the rough that we've really missed and everything. And I'm going to continue in every way I know to try to figure out a way and a solution for us to grow population. But I say to all of you just this: the biggest miss that we could possibly have ever had in 2021, and it'll go down in history as this: we were poised in a position to be able to get rid of our state income tax or be on a glide path to be able to do that. That would have really changed this situation, and it was a big miss. And at some point in time, if the opportunity provides itself again, we need to revisit, and we need to look, and we need to look at a way that it can be done and accomplished without getting on a glide path for 100 years or whatever it may be. But absolutely, and you need to listen to me, West Virginia, if you truly understood all the aspects of how we could get rid of our state income tax and do it and immediately put more net dollars in your pocket, without even thinking about it, from a standpoint of, different taxes that would have to be raised here and there, but you would end up with more net dollars, more dollars in your pocket, and in most instances, significantly more. There's a way to do it, and we need to look again, because this situation of losing population is really critical. And in West Virginia, you're growing in tourism, you're doing all kinds of great things. Absolutely, we're diversified. There's so many, many good things going on in West Virginia right now. We're building roads. You see so many orange cones you can't even see straight. And we're working on this day in, day out. And we're going to continue to work on this population decrease, because that's a problem. That's a real problem. You got a lot of elderly people in West Virginia, and as we lose our elderly people, if we don't replace and we don't absolutely find a way to start really growing, this situation will only get worse. And by less and less people, it means less and less revenue. And as we have less and less revenue, that's going to be less situations for our schools, that's going to be less situations for our roads. We had a great idea, and it was a big miss. But nevertheless, we're going to keep on plowing, keep on and doing all the good we can possibly do. You know, I read to you, about the mask and the vaccination requirements and mandates or whatever that the colleges, from West Virginia Wesleyan and Marshall, and what was going on in Mon and Kanawha counties, but the net of the whole thing is we need to remember that right now there are no mandates, there are no plans for mandates, and what we're doing is we're letting the local people make decisions, because one size doesn't fit all here, and we're going to continue down that pathway until we reach a situation to where the medical community comes to me and says, Governor, you got to move in this direction or that direction, and then we'll visit it and we'll look at it in a different light. And all we can continue to do is hope and pray we don't reach those levels. Okay, Kanawha County Commission Vaccine Incentive Program. Yesterday, the Kanawha County Commission announced the Kanawha Team Vaccine Program. Through the program, all in-county sports teams, cheer squads, bands, show choirs, and other extracurricular teams will receive financial incentives of $2,500 to their booster programs or the school if 90% of their team participants get vaccinated. The commission said the American Rescue Plan funds will be used to pay for this program. I think it's a great idea. Absolutely. I commend the commission and for starting, this program and everything. It's $2,500 to their booster programs for all the extracurricular teams. That includes, bands, show choirs, everybody. It's $2,500 if 90% of your team gets vaccinated. So way to go, Kanawha County. I love it. The Kanawha County Commission stepping up, and it's just more and more incentives to get our people across the finish line and get them vaccinated. The baby dog sweepstakes ended with terrific success. We have we created a little video of Do It for Baby Dog winners, and are you guys going to show that? All right, just wait 1 second. I can't tell you, I can't tell you how successful I think the whole program was. Sure, we put some money in it, but just think about it. We almost, from when we started to today, we almost got 200,000 people vaccinated that hadn't been vaccinated. 200,000 people. How many lives did we save? It was unbelievable. Show the video. I haven't seen it. I'd like to see it. You just won this truck.
Wait, what? No, I didn't.
Yes, you did.
Oh my gosh.
Got a little something special for you. You won one of the big giant trucks. The next millionaire in the state of West Virginia. Where's Sharon Turner?
Ah! I just
I don't know how you could have a better official spokesperson that loves everybody and makes everybody smile than Baby Dog. And you know, and I said over and over, if you don't want to do it for yourself, you don't want to do it for your family, do it for Baby Dog. Baby Dog's coming to see you because you just won one of the big giant trucks. This is yours, son.
Are you serious?
Turn around,
Just do it because it saves lives, I think.
This is Governor Justice, and I'm trying to remind everybody to absolutely get your vaccine. But right now, I've got an English Bulldog down here named Baby Dog, and Baby Dog is looking for Shannon Cook to come immediately to the front of the store because we've got a great big giant truck that we're going to give her if she'll make it here really quick. And Bill, if you'll tell Heather's name.
Heather Coburn.
Is she here? Baby Dog. I think it's never happened to me before.
Oh, it's really good.
Baby Dog.
Oh, but Megan, the reason we're here, this is yours. You won this in our drawing.
I think my brain just shut off. Like, I'm shocked. I thought I was going to a meeting, so.
Do it for others, not for yourself, you know.
And you just won $1,588,000. You sure did.
I can't believe it.
Really great. I love it. That is great. Way to go, guys. I just think it's just wonderful. So, Baby Dog, you know, 200,000 almost we got vaccinated. We need to figure out something else. Mark Curtis maybe had a great idea, but boy, that's a great video. Thank y'all so much for doing it. And I hope everybody enjoyed that. That was really good. That's all I got.
All right, thank you, Governor. Let's now go first today to Secretary Bill Crouch with the DHHR.
Good afternoon, everyone. I want to take this opportunity to mention a few issues we have with the dashboard today. DHHR was informed of unreported test results from Berkeley and Morgan County counties, which had not been received by the state. The issue involved labs dating back several months. One lab in particular, results were not received by DHHR. We dug into that issue and we've determined that it was a technical error that was not identified by the vendor that is responsible for assuring that connections are made between all of the labs in the state and DHHR system. DHHR is downloading the unreported files and is manually entering those records into the system today. And we will update the dashboard later today. We apologize to the health department of Morgan and Berkeley counties and to the citizens of Berkeley County. This is an issue that we want to make sure doesn't happen again. We've actually asked our vendor to do an audit of all labs in the state that are connected to the system to make sure there are no other issues there, and to provide us a daily report from now on so that we know how many labs are coming in, how many results are coming in from each lab. Also, you will note that today's positivity rate is very low and that there are low case counts in some areas. This is the result of an update to the state's surveillance system. This is an upgrade, was an upgrade to the system that took place yesterday. The upgrade resulted in a low number of assigned cases in the surveillance system. As end users get comfortable with the updates, this will speed up the production level. On the next dashboard update, there will be an increase of cases for August 12th as cases are processed and assigned to the surveillance system. Finally, we have automated the process of vaccine breakthrough cases, as I discussed earlier in the week. As files are merged to identify if a case qualifies as a breakthrough case, the positive case and vaccine administered dates have to meet a threshold to qualify. What this means is there's a natural lag to identify breakthrough cases, and we're working on updating that and speeding that up. So as always, the governor has asked that we be absolutely transparent with regard to what we do with the dashboard. So I hope that helped. Later this afternoon, towards the end of the day, we should have the dashboard for the most part corrected for the Panhandle. Again, I apologize to them. We also will have tomorrow, during tomorrow's update, or actually it'll be Monday's update, better case count from around the state. So some of you counties, if you see your numbers off a little bit, it's due to the update that was done on the system yesterday. So I hope that helped. Thank you.
All right, thank you, Secretary. Next to Dr. Clay Marsh, our coronavirus czar.
Good afternoon. And as the governor has mentioned, we continue to see growth of COVID-19 new cases in West Virginia. We still see growth in hospitalizations. And as we look across our national landscape, we see that we are still averaging over 100,000 cases, new cases a day of COVID-19. We see that deaths are starting to pick up. Over the last couple of weeks, we've doubled the average number of people dying in the United States from COVID-19. And very importantly, we're seeing a real change in the demographic of the hospitalized population. 8 states are responsible for 51% of the hospitalizations in the United States. And what we see today versus what we saw at the earlier stages of our pandemic before vaccines is we see the number of older Americans hospitalized go down by 3/4, and we see the number of younger Americans go up in that corresponding way. There's more 30 to 39-year-olds in America's hospitals than ever before in the pandemic, and we're seeing people who are very young and otherwise healthy who are unvaccinated go to the ICUs and be on ventilators. 2 very touching stories, both pregnant moms that delivered their babies early because of the impact of COVID-19. One mom got to feed her baby once before she died, and one mom is still in the ICU and has only seen her baby over Zoom. So as we look at this pandemic continuing to grow with the Delta variant and continuing to grow in West Virginia, we still are on the earlier side of what I believe is going to be a still turbulent time for us coming up. Then, as the governor said, we know that the really foundational way that we can protect ourselves and not be sources of new variant formation is by getting fully vaccinated. And for those people out there that have asked, well, what's a variant? A variant is really just this virus. When it infects people, it multiplies. And as the virus multiplies, it makes a lot of mistakes. So every generation it creates, every time it multiplies, it makes mistakes. And these mistakes are changes in the virus's genetic sequence. And when those changes add together in a way that the virus gains additional advantages, like we've seen with the Delta variant, which is much, much, much more contagious than any that we've seen before, then we call it a variant. It's just a different strain of the virus that has gained the benefits of being able to infect people better. And because of that, and we've talked about the Delta variant being extremely infectious and extremely able to spread, then it is so important that people get fully vaccinated, everybody eligible, including young people, because that full vaccination is really good at protecting you from getting severely sick, being hospitalized, going to the ICU, or dying. And that is really the most important manifestations of this virus that we are trying to prevent. But also importantly, as you start to go out and be with other people, particularly as you're with groups of people, many of whom may not have been vaccinated, then we also want to be good citizens. And I think it's really important that people consider wearing masks in that situation. The Centers for Disease Control recommend that everybody wear a mask if you're going into an area of high incidence of COVID-19. And now virtually all the United States is a high incidence area of COVID-19. But the reason for that is because masks with this particular variant are good about reducing the droplets and the concentration of the virus around, but they're not quite as good alone by reducing the risk of people that are not vaccinated to getting infected from COVID-19. So if people wear masks in these indoor environments, it reduces the amount of the droplets and the amount of the virus that is around, so that all people, and particularly people that are unvaccinated, that are really the ones at risk for these severe complications, are protected better. And lastly, the governor announced that the Food and Drug Administration has approved the boosters for people that are immunocompromised. In order for that to be actionable, in order for us to be able to give vaccine doses, the Advisory Committee for Immunization Practices from the CDC needs to also agree, and they will send out their guidance. We hope to be able to share that guidance very quickly and reach all eligible West Virginians rapidly so that we can protect our most valuable resources, which is each of you. Thank you.
All right, thank you, Dr. Marsh. Next, we'll go to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good afternoon. As the governor pointed out, we did have a strong week through yesterday. We will hit 90% of the age 65 plus population next week based on our trajectory. We're still moving well at age 50 plus, but we know we need to get above that 85% mark and hopefully to the 90% mark on the age 50 population. Two things we know is that historically in West Virginia, 97% of our deaths and 97% of our hospitalizations early on before the Delta variant were based on population age 50 and above. We know that is changing to some degree. So at the same time we continue the push for age 50 and above, we have got to work on our younger population. We'll continue to work that. I know a number of people have asked how many people in West Virginia may fall under the new guidelines from FDA. Until we get final word from the CDC and the committee, we won't know those numbers, but be assured that we are planning and we are coordinating with county and other partners to make sure that we have doses available and we can maneuver around where we need to once that is officially approved to move forward. Last thing I would leave you with, again, to try to highlight the need for vaccinations. Jordan, if you could put up that hospital chart. This is the most recent chart for hospitalization trends compared to our prior numbers. Jordan, do we have that? Yeah. So again, look at the blue line. That's from our initial surge, 800 plus cases at our high point, and look at the orange trend line right now. Clearly, we are headed in the wrong direction related to that. We also know that the frequency and the ratio of the ICU cases to total cases continues to climb. So we are in a challenging spot, and we need more West Virginians to get vaccinated so that we can continue to address the Delta variant, but what is coming behind us with the next couple of variants that we'll probably see before we get to the end of this. Thank you.
All right, thank you, sir. Dr. Ayn Amjad, our state health officer, is also joining us today and is available for questions. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. I wanted to ask a little bit about our plans for these third booster shots. I know General Hoyer just said we don't know exactly how many West Virginians this will be applicable to, but I was wondering if we could talk a little bit about the strategy for reaching those eligible folks. How are we going to let these folks know that these are available and where that they can get them? Thank you.
General Hoyer, you sir. And Charles.
Yes, sir.
Charles, one of the ways we're going to let them, we're going to contact them is just the way we're doing right here. With if everybody just dial in and tune into this just a little bit, we'll be able to tell them. But anyway, General, go, please.
Yes, sir, Governor. So, Charles, part of what we're doing right now behind the scenes is working with county levels. We know, based on the initial guidance from FDA, what those potential numbers could look like, but it's all going to depend on that final assessment that comes out. But what we'll do is we're currently working directly with county level health departments. We're putting together plans to do outreach to care providers because they'll be engaged in this as well. And then through the Bureau of Public Health, Dr. Amjad will push out guidance specifically, and an individual may go to the local pharmacy with the appropriate guidance. There may be clinics set up at county health departments and other locations, just like we did. We'll have to provide a variety of outlets for people to get the vaccine, and we're prepared to do that.
All right, thank you, Charles. Next to Kenny Bass with WCHS and Fox 11.
All right, got a couple of quick hitters and then one longer question. So some notes for these. There's like three of these real quick. One, are there any differences for cleaning and sanitizing procedures for COVID-19 variants like the Delta variant rather than what we've already been doing? That's the first one. The second one, enhanced food stamp benefits. Are those going to be continuing? Governor had some questions from Preston County on that to help continue to help this. Third, if I helped her, Amjad could make a quick comment about the second shot disparity between fully vaccinated and second shot. And some of these people that are contacting me and saying that they've been advised by their doctor not to get it because they had a bit of an adverse reaction to the first shot. So tingling of the lips and mouth, soreness, things like that. So is that, do you think, the major reason between the difference between first and second shots? And finally, the major question, Governor, Dr. Marsh just spent a long time talking about the efficiency and the helpfulness of wearing masks. And I know you're saying leave it to local control and let these people decide. But if we're going to get serious about this thing, according to people who've reached out to me and wanted me to ask, WVU right now, as far as I'm aware, doesn't have a mask requirement unless it's changed. If Dr. Marsh could address that and things like football games and the state fair, which is now going on, and a big concert I just went to last week. James Taylor was in Charleston. Is it time to just drop the hammer, say put a mask on along with getting vaccinated? Because this segment of the population is saying that get serious, let the rubber hit the road and just do it, even though people aren't going to like it because it's for the best interests and the health of the state. Your reaction to those types of opinions about the mask mandate. Thank you.
Okay, let me do the last one first, okay, and then I'll hand off on the other ones. But Kenny, I've tried all through the entire process. The number one thing that I want to do is do what's right for the people. I'm not going to do anything that's politically right at all. There's no way. I'm going to do everything I possibly can to protect the people, but I'm going to listen. I'm not a doctor. I'm going to listen to the health experts, and I'm going to make the very best decisions that I can possibly make. with all that, Kenny, right at this moment, I do not see, nor am I going to do, right at this moment, do I see a need for us to have masks. It may very well be that, in the days ahead, this thing continues to rear an uglier and uglier head, and we've got to move, and we've got to move that way. But today, I do not have the information in front of me to move to a mask mandate at all. The biggest thing that we've got to worry about here too, Kenny, is just this. How have we been this successful? I mean, when it really boils right down to it, I'm really proud of the recommendations that I've made. I'm really proud of the recommendations that my staff and all the experts have brought me. But Kenny, like it or not like it, it is a miracle from God above that this state has 2,976 deaths and no more than that at this time. It is a miracle that we have shepherded our way through this as best we can, but the miracle could have never been possible if we hadn't stayed together. It is so easy to divide us today. So easy. If we drop the hammer right this minute and do a mask mandate, you'll have all kinds of division happen immediately. It is a fine line that we've got to walk, and truly, there will be a point in time where maybe we've got to go that way. But today's not that day. And let's hope and pray that that point in time does not come about. I'm doing everything with all my power to avoid putting our people back in that situation. And I'm going to continue to try to do so, but today I don't see a need. Now, if we could go back to the other things, and as far as the cleaning and the sanitary stuff, as far as COVID or the variant, the food, maybe I can answer the food real quickly, Kenny. As long as I have anything to do with it, we got people in the state of West Virginia that are hungry, and we got to absolutely step up no matter what. We have got to continue programs as far as feeding our people. And there's no way I'm gonna move in any way off of that. And so maybe really what we need to do is talk about, I guess the last thing was the second shot, but the cleaning and sanitary, maybe Bill and Ian could talk about all that.
Thanks, Governor. Kenny, I'll answer that, and then I think Clay had the WVU question, but the cleaning is not any different for the variant, so you still want to clean with something that is at least 60% alcohol based, so the cleaning is the same. And then as far as the second shot, unless you have an anaphylactic reaction, we'd still want you to get the second vaccine shot because you would not be fully vaccinated. So if a patient tells me, their arm is sore or they had a little tingling or numbness, you'd want to ask them, a few more questions if, why maybe their vitamins are low or they'll have some electrolyte disturbances, or maybe there's something else to that and try to allay their fears, but you definitely want them to get the second vaccine. But then I'll let Clay answer. I think you asked a question about WVU or something.
Thanks, Ian. There is, in my understanding, Kenny, no mask mandate at WVU. And I would just add very briefly, what the governor said is, to me, spot on. When we make recommendations like the CDC does, we're trying to make recommendations to help people make their own decisions. And obviously, local decision making is best because different places are certainly different. But for people that are listening to us, we want to make sure we give them all of our best guidance and information so they can choose the best way to protect themselves and their families. And if we do that successfully and stay together, we protect all of West Virginia, which is really our overall goal.
All right, thank you, Kenny. Next, we'll go to Annie Moore with WVVA.
Good Good afternoon, everybody. I know that at least 2 deaths have been reported in the nursing home outbreaks in Fayette and Raleigh counties. Do we know yet whether these deaths are breakthrough cases and or the Delta variant?
Maybe Dr. Armstrong, could you answer this, or Bill? Y'all can answer this better than I.
Yes, Governor, I can answer that, Annie. So the one, I believe in the Hilltop one was the Delta variant, Annie, and then half of those were related to vaccine breakthrough cases. So they are concerning because most of the patients there have been vaccinated, but they are related to the Delta variant, and some of them were vaccine breakthrough cases.
All right, thank you, Annie. Next to Paul Mullen with WCBC.
Good morning, everybody. Question for the medical panel about the Delta variant. Is it moving through the younger people because there are just so many more younger people not vaccinated, or is there something about Delta variant that attacks the young more efficiently than the original version of COVID-19 did? Thank you.
Dr. Marsh, you got to get this one.
All right, Governor, thank you. And thank you, Paul. The feeling is at this point, the reason why young people are being more readily infected than others, number one is, as you correctly point out, that full vaccination does matter, and it reduces your risk of reinfection by 8 times, reduces your risk of hospitalization by 25 times, reduces your risk of death by 24 times. So the less vaccinated status is part of it. But probably the more important part of it is just that this particular form of COVID-19, the Delta variant, exists in 1,000 times higher concentrations in particles that are aerosolized from people who are close to each other and who are talking, yelling, screaming, singing, panting, and it seems to be able to spread outside better than other viruses, other COVID viruses we've seen. But if you look at the ability to infect, this is a several sort of exponential fold more able to spread, as the CDC said, like the chicken pox, than from what we've seen before. So kids, young people tend to gather in bigger social networks and gather in sometimes in close quarters in, say, bars or in gatherings. And those gatherings tend to be the kind of the fertile ground for the virus to spread really rapidly, like we had talked about in Cape Cod, where 3 different groups of people, one from Atlanta, one from Houston, one from Los Angeles, came to this really upscale beach town where many people were vaccinated and where there was a lot of people that got infected. But the vaccinated people didn't get sick, didn't go to the hospital, didn't go to the ICU, didn't die. And that's really what we're trying to prevent. But we also want people to be smart when they're around each other because of how easily this virus spreads.
All right, thank you, Paul. Next to Mark Curtis with Nexstar Media.
Good afternoon, everyone. A couple of questions regarding the Delta variant. First of all, we had updated numbers today. I was surprised because I know originally we were only getting Delta numbers on Tuesdays and Thursdays. Are we going to have an update every day? Because it was updated again today. And the bigger question I have is, Tuesday we had 161 cases. By yesterday, 299. That was an 86% increase in the span of 2 days. Are we likely to see spikes like this over the next few weeks? And what concerns do you have about that?
Bill, maybe you can do on the update, and then maybe Clay, maybe you got to jump in on the Delta big jump.
Yes, sir. Thank you, Mark. We are trying to update those variants daily. Part of that is a manual process, so we're having to do that on Sunday to get Sunday evening to get Monday's variants done and so on. But we are moving to a daily update on those. It's important we get those as quickly as we can. But as I've talked before, the sequencing for that takes some time. So our folks estimate 10 days to 2 weeks to actually get the results from that. So it's not actionable information, public health information, but it's important information in terms of guiding us as we go forward. So hope that helps.
And I would just add, Mark and Governor, that as we look at the Delta variant, we know now that that's responsible for over 91% of the new viruses that we're sequencing. And as we go forward, we know that we will continue to count more Delta variants among the positive cases that we see in West Virginia. And the critical feature now, Mark and others, is that we are doing everything we can to try to reduce that rapid spread, to buy us more time, to have the hospitals and other systems not be overwhelmed by a really rapid and explosive number of people that might get sick all at once from this increasing spread that we are seeing, and we anticipate to perhaps even get greater. So if we can spread that out over a little bit more time with people being vaccinated and doing other mitigation measures, being smart, taking care, being socially, physically distanced, wearing masks and avoiding big crowds, et cetera, then that will reduce that stress on our health system, which is also really important as we go forward in this.
Yeah, this is Bill. Let me make one correction, Mark. I meant to say we were doing the variances on the day of the press briefings on Tuesdays and Thursdays. We've changed those to match the days of press briefing on Monday, Wednesday, and Friday. So we have folks do those on Sunday evening, they do those on Tuesday evening, they do those on Thursday evening. So we are following the press briefings to have current information for the briefings. Thank you.
Yeah, thanks, Mark. Next to Evan Bevins with Ogden Newspapers.
Thank you. Dr. Marsh, you mentioned earlier a couple things I wanted to follow up on. One was about the Delta variant. I thought you said it spreads easier outside. I know being outdoors was one thing, people were thinking was obviously safer with the previous versions. And also you mentioned the Delta accounted for 91% of new cases, and I didn't know if that was statewide or nationally.
Okay, Clay, go. I think, well, go ahead, Clay, I'm sorry.
Thank you, Governor, and thank you, Evan. So just to make sure that I'm being perhaps more precise in what I'm meaning. So we know that outdoors is certainly safer than indoors for all forms of COVID-19, including the Delta variant. The Delta variant, though, because of its really rapid and efficient ability to spread person to person, has been documented to be infectious outdoors more than any form of COVID-19 that we've seen. And that's the reason why we would make that recommendation for people who are outdoors with mixed groups to consider wearing masks and maintaining physical distance and being smart, because even though outdoors is certainly much safer than indoors, that it is certainly more possible for the Delta variant to spread outdoors between people than for other variants we've seen. But if you're outdoors by yourself, you should still feel safe from being exposed to the Delta variant. When it comes to 91% of our cases, that is in West Virginia to date. What we know nationally is that the Delta variant accounts for now more than 83% of the cases around the country.
All right, thank you, Evan. Next to June Leffler with West Virginia Public Broadcasting.
Hello, good afternoon, panel. I would like to ask some more follow-up questions about booster shots. So could you just explain for the people that might fall into this category of immunocompromised and those with organ transplants, what exactly they would need to do to get these shots? Are you foreseeing that they would need to get a referral from their primary care doctor? Would it be that, would they have to go through all that? Or would they need to just provide some sort of documentation to the clinic? Just what would that look like?
Okay, Dr. Marsh, we're back to you again. You're a busy man today.
Thank you, Governor, and thank you, Jim. So we are going to wait for specific guidance from the Centers for Disease Control, their advisory panel that specializes in the application, what is the evidence, and what is the best use of now this new guidance around booster doses. In the past, the concern has been that really there's three groups of people that may be at risk, higher risk for reacquiring COVID-19, and maybe even having some higher risk of substantial, more severe effects. Particularly, as the governor has said, as we move farther away from when people got their first vaccines and second vaccines. So we know, for instance, people that are on medication that intentionally suppress their immune system, like for immune diseases like rheumatoid arthritis or Crohn's disease or lupus or other like diseases. And these medicines might include medicines like prednisone or other like medicines. Then those people are at risk for not having their immune system respond as well, because we're trying to suppress that immune system from attacking their own bodies. And so those people don't respond to vaccines so well. Similarly, people that have had organ transplantations or have certain kind of cancers or who are getting active chemotherapy for those cancers, they may not respond as well either. People on chronic hemodialysis and have kidney failure, they may not respond so well either. So that group of people are people that are thought to be immunosuppressive because of coexisting conditions or treatment for those conditions. The next group of people that are felt to be potentially immunocompromised are people over 60 years old who have had their vaccine 6 months ago, first vaccine or more, or their second vaccine 5 months ago or more. And these are groups of people, say, for instance, like in Israel, who are being revaccinated and are planning. Other countries like France and Germany and Russia are also planning, and the United Kingdom, to consider this group of people. And they are also felt to be more immunologically vulnerable to being reinfected from COVID-19 and perhaps getting sicker from that. And the last group, which is a bit of maybe a more debatable group, are people that have only gotten one dose of the vaccines. As we look at people, as was asked previously, that haven't completed their vaccine regimen, but only have one dose. And then there's more debate about people that say received the Johnson & Johnson vaccine as a single dose. We know if you've taken one dose of the Pfizer Moderna, you really do need that second dose, and we want to give that to you. If you've gotten one dose of the Johnson & Johnson vaccine, that's guidance we're waiting on. But those are the groups of people we'd be talking about. I think the first group of people would be the primary group of people focused by the Food and Drug Administration and the Advisory Committee for Immunization Practices, who are waiting for that guidance and then trying to determine how we meet the needs of the vulnerable people in West Virginia so we protect them from those severe side effects of COVID-19.
All right, thank you, June. Governor, I'll turn it back to you.
Okay, I think the only risk that the only notes that I've made are we emphasize over and over that our young people are at some level of risk, especially with this Delta variant. Our young people should realize that. Their parents, their grandparents should realize that. And we need to get them vaccinated and get them vaccinated right now. They're going back to school and we need to get them vaccinated. We need to clarify one more time on the mask, and I don't know why we need to clarify on the mask and the mandates, but it's just as simple as this. Anybody in the world, I'd challenge anybody that was sitting in this chair. If you absolutely believe you can sit in this chair and not absolutely be ready to move to a different position, you're crazy. Absolutely today, we do not need, in my opinion, a mask mandate today. Does that mean we're going to inevitably or we're never going to get to a mask mandate? I hope and pray that be the case. But really and truly, if this thing turns terribly ugly and the advice comes to me that we need to move that way, I'll move that way. But today, we all need to realize very clearly that today, Jim Justice, as your governor, does not believe that we need a mask mandate today. Now, and for God's sakes of living, the last thing we need to do is fragment ourselves and start mandating against mandates. And so with all that being said, I don't know how to be more clear than to just say just this. Along the way, if you had one red county and all the rest green beyond belief, you need to have local control, do you not? But then if you walk in a week from Thursday or a week from Friday and you have every county in the state red as it can be, you have to change, don't you? Don't you? I mean, for crying out loud, we need to quit twisting words. We need to quit, making up stuff. All you've got to do is listen. I'm as simple could possibly be. Just count the egg-sucking cows. You don't have to count the legs and divide by 4 with me. I always just tell you count the egg-sucking cows. I've told you, I'll tell you when I've changed, and we need a mask mandate in this state. But today, we do not need a mask mandate in this state, in my opinion. And I hope that we're not going to have that. If in fact, this situation gets bad enough that the health experts and everyone says we need to move that way, we will. But you need to know, West Virginia, one thing loud and clear from me, and that is just this. We need to stay together. We don't need to fragment. We need to pull the rope together. Don't listen to this silliness that people try to twist words around and everything. Today, I can't be any more clear. And the only thing I'd end with is just this. That's the first time I had no idea you were doing a video. We did it in-house, I'm sure, and probably Kelsey was involved in some way and everything, because she does great work on our video stuff. And I'm sure, Nathan, Jordan, Mitch, all y'all did great work. But let's show it one more time and end with it. And if you want to go, that's fine, but we're going to end with it. So show it one more time.